Thank you so much for taking the time to review this presentation on homelessness. The title of our presentation is Putting Money Where Our Mouth Isn't: How the Reallocation of Resources Can End Homelessness. It was put together by myself, Danita Jackson, Patty Birchall, Sue Nichols, Kirin Lipford, and Kristin Wright. Our intended audience for this presentation was the Mayor of Tempe and City Council, as well as the Tempe Community Council. This man here represents just one of 37,404 people who were homeless in the state of Arizona in just 2017 alone. Think of the many times that you may have been sitting in your car and turned your head in the other direction, or pulled down your visor, or even looked at your phone, something shuffling through your briefcase, anything just to avoid eye contact with someone holding a sign such as this. Maybe you even took pity on them and gave them a few dollars. Maybe you even got upset because panhandling is illegal in your city. No matter how you may feel about this individual, and regardless of how you react, homelessness is still a persistent problem in our state. You can turn a blind eye if you'd like, but it still doesn't change the fact that there are thousands of people living without homes each and every day. This chart shows the number of people that were considered homeless at one point in Arizona over the past 7 years. It's sad to note that it significantly increases as of 2014 and beyond, and since then, homelessness has increased by almost 10,000 people, with 86% of those experiencing homelessness, they live in the metropolitan areas of Maricopa and Pima counties. Now, to put this into perspective, that means 1 out of 184 people living in Arizona, they were homeless at some point during 2017. Now, think about your family members, your friends, your acquaintances, people that you know, and ask yourself, can you think of 184 people? Now, imagine that one of them would be homeless in the next year. Now, of course, you may be thinking, okay, but how accurate are these numbers? How do I even go about counting homelessness? Well, the data shown in this chart, it was collected by the Homeless Management Information System, and it complies with the U.S. Department of Housing and Urban Development, better known as HUD. Now, the HUD definition of housing, it's defined as a person lacking a fixed, regular, and adequate nighttime residence. That means any person staying in a public or private place that is not meant for habitation, that person will be counted. Those counts include people living in cars and tents, sleeping at a bus stop or an abandoned building, or even the unsuspecting friend that couch surfs every night. People living in shelters as well, they were counted. According to the Maricopa Association of Governments point-in-time analysis, the amount of displaced persons in Tempe were second to that of Phoenix, Arizona. Think of the sizes of those cities, and Tempe was second. This count continues to rise, notating a growth of 25% from 2016. In addition to joblessness and mental and physical health challenges, the lack of affordable housing poses as the greatest challenge to Tempe's at-risk and homeless populations. Of those landlords who choose to participate in the city's Section 8 Housing Choice Voucher Program, that number is steadily declining, citing a stigma associated with working with the economically challenged. Currently, programs offering rental assistance receive an excess of over 1,000 unmet requests. Now, this huge gap, it points to a change that is desperately needed to bring balance to the level of empathy that is lacking in our community towards our fellow Tempeans who are experiencing chronic homelessness each and every day. Unfortunately, efforts to address this problem have been severely misguided in recent years. Instead of offering support, policies focus on criminalizing activities associated with homelessness, such as making panhandling illegal within city limits and limit assistance for those in need. We need to take positive action to improve and provide homes because homelessness affects everyone economically, socially, and psychologically. As taxpayers, citizens, and human beings, it is everyone's problem. What most people don't realize is that homelessness can happen to anyone at any given time, and often homelessness is a product of circumstance. And there are many factors that lead to homelessness, such as an eviction due to falling behind on rent, because someone lost a job or is trying to pay medical bills. More and more people are losing jobs due to technological advancements in the workplace. Even full-time workers have difficulty paying for housing, and some people become homeless after a divorce or when they're fleeing a domestic violence situation. And of course, there are those who have a mental illness or substance abuse addiction, which that has led them to experience homelessness. For some, the mental health issues and the substance abuse, it doesn't begin until they are forced to live in a temporary homeless shelter where they have increased exposure to infectious agents and decreased security. Historically, religious groups and nonprofit organizations have been the primary support systems to assist people affected by homelessness, while the government has offered little to ineffective support and funding. Homeless individuals are more likely to suffer from poor health, and many have no health care. Those who are receiving health care are on Medicare or Medicaid programs. Increased homelessness means increased government funds spent on the medical care of those individuals. In our current state, homelessness is creating an economic Clio. As more programs continue to limit their scope of reach, more families who are denied otherwise available resources will be forced to become an unattended burden of the state. Ultimately, this will have a direct negative impact on the governing budgets of Arizona. This will cause a negative domino effect, which will require the need for additional hours of labor for policing, waste management, and social services. Instead of taking money away from bettering our community to manage an unresolved problem, we are proposing a better system to distribute resources and funding so we can ultimately end the cycle of homelessness. Currently in our state, the Arizona Housing Coalition leads the effort to reduce homelessness. They use a tripartite approach, which includes education for agencies serving the homeless, advocacy to state legislators, and collaboration with local organizations and communities. This coalition was formed in 2017 from the merging of the Arizona Coalition to End Homelessness and the Arizona Housing Alliance. The goal of this merging was to have a greater impact on policy and resources, and may be partially responsible for the slight decrease in the count of homeless people in 2017. Now, this is a clear example why the coordinated efforts are so important and effective in ending homelessness. We know that federal and state funding levels determine the reach of the nonprofit and religious organizations offering aid. Federal funding that is designed to support efforts to reduce homelessness would fall under the grant for the Temporary Assistance for Needy Families, better known as TANF. In Arizona, 61% of the federal funding received under the Temporary Assistance for Needy Families program is spent on non-assistance that is not directly providing support to needy families. This amount is represented in the red. And you can see in just how significant this amount is, especially when it's compared to the amount of money that is providing direct assistance to families, which is in the green that you are seeing there. A mere 15% of those funds are invested in direct assistance, such as cash assistance, work-related support, and child care. Knowing that funding is related to program reach, this is very eye-opening because there is little funding being offered towards this cause. The State Housing Trust Fund is the only state resource devoted to addressing Arizona's housing needs. Since 2009, the $40 million budget for this fund has been reduced to a mere $2.5 million. due to the recession. The virtual elimination of this budget and subsequent rise in homelessness affects the importance of smarter management of what little funding remains. Connecting a system of dedicated government officials, social agencies, emergency responders, healthcare personnel, and persons of the private and public sector can collectively drive substantial change in reducing the number of homeless persons within a short time frame. We propose the implementation of a pilot program that will reduce the number of homeless individuals in Tempe, Arizona through use of a standardized procedure of documentation and collective execution for the benefit of the homeless and citizens and city officials. Our vision is to connect those local agencies providing services to the homeless so that all the available resources can be effectively managed. For example, if a homeless person presents with a substance abuse problem and is referred to a program to address his or her substance abuse and then shows up at a different agency on a different day, the new agency can see where he or she was referred and if he or she received care. If one agency that provides shelter is at capacity, then it would be beneficial to know in real time what other agencies have space available. By connecting service providers, we are able to coordinate care and reduce the workload and resources associated with multiple referrals. We feel this connectivity can be achieved easily by creating a web-based interface that all the agencies would use. Imagine a web-based application that acts similarly to an electronic medical record where all personal information is stored and referrals are as easy as a click of a button. Now, this method would include the collection of personal data from each homeless person and maybe even a picture. The assessment of their needs would be stored in their chart, so if they show up at a different agency, the needs assessments would already be available and there would be no need for duplication. This would allow service providers to be able to take everyone under consideration when ranking needs in order of severity and/or urgency. This would also allow for improved and efficient allocation of community services and resources to get those needs met, including continued follow-up with each case. Now, in order for this system to be effective, consistent forms and validated assessment tools must be used to complete screenings, and the ability to determine risks and needs allows for a continuum of care between agencies. An example of a validated tool that could be used is the Patient Health Questionnaire, or PHQ-9, which is a self-reported assessment of mood and may screen for depression. The incidence of substance abuse in homeless people, it's well known, and another tool that would be useful is the TAPS tool to assess the use and extent of abuse of tobacco, alcohol, prescription medications, and other substances. A benefit of this tool is that it could be self-administered and/or administered by a clinician. Not just adults are affected by homelessness, obviously, which is why it would be useful to utilize tools such as the CRAFT 2.0. This tool screens behavioral factors in children ages 12 to 18, and it's also recommended by the American Academy of Pediatrics Committee on Substance Abuse with Adolescents. Now, these are just a few examples of tools that could be used within the model that we are proposing, with each agency using the same assessment tools to complete screenings and determine risks and needs. This allows for a continuum of care between agencies. A shared interface of records would allow all local agencies to work efficiently with one another, track people in need, prioritize those needs, and read home persons in Arizona. Now, getting all organizations involved, it's imperative to be able to eliminate confusion and miscommunication. A centralized interface would allow all involved agencies to easily follow up with persons to identify issues and to ensure increased housing retention rates. As you can see in the photo, decentralization would lead to certain agencies not getting all the information that they need. It could cause confusion and limit productivity when trying to end homelessness. Through targeted communication and tracking housing retention, over 88% of tenants who were once homeless were able to maintain their housing for a year or longer. What this means is that an integral part of our solution is ensuring that once rehomed, people continue to receive support for things like healthcare, jobs, childcare, and so on, so that they are able to maintain their homed status. We know that one problem with the current approach is that services are very much uncoordinated, sadly, and oftentimes support at this stage is no longer offered, or people fall through the cracks. With a centralized system, we would be able to monitor and evaluate who is getting that support and who needs more support. The more individuals that we can rehouse will equal less burden on the state and the city budgets. Each individual that is homed saves the state and federal budgets approximately $10,300 annually per homeless individual. So not only does it lift the burden off of the government budgets to assist these persons in need, it also helps because that money can go towards improving upon our systems that work. Savings from the implementation of this program may be then reinvested in developing homeless prevention programs, which are much more cost effective and require fewer resources. The savings can also be used to expand emergency rental assistance programs, Section 8 housing, or provide incentives for the reimbursement of rundown apartment buildings to increase the overall value in our neighborhoods and be dedicated to long-term housing for the previously homeless. The solution is hope. There are 11 agencies in Tempe offering services to the homeless that are funded by the City of Tempe's Human Services funding. We request an allocation of this funding to be able to develop and implement this pilot program, which will lead to downstream savings for the city. People who are housed are less likely to need the use of the emergency services such as hospitals, jails, and emergency shelters. The implementation of this program would not only reduce rates of homelessness, but it would relieve the city of expenses associated with homelessness and improve the overall health of Tempe's citizens. Housing, by far, is the most important element in reducing homelessness, and all other programs are secondary. Allocation of resources and funds need to reflect this basic need for housing. We want a better solution. The city of Tempe deserves a better solution. The state of Arizona deserves a better solution. Our whole world, we deserve a better solution for the citizens of this planet. We see the problem. We see what has been done. We see what still needs to be done, and we are offering something proven that we believe will work. There is actual hope in ending the cycle of homelessness. It is our hope that you will see the benefits for all in our proposal and join us in ending the cycle of homelessness for once and for all. Thank you.